Okay. Well, I think we're live. Good afternoon, everyone. Welcome to our May 2020 Legislative Action Committee meeting. We made it to May. We've had a very busy last few months, and so we're especially happy to have here this afternoon 30, I think we had over 40 people sign up for this meeting. And we're pleased to have our two special guests this afternoon, County Supervisor Joe Simidian. And after Supervisor Simidian, we will be hearing some updates from Cupertino City Manager Deb Fang. So with no further ado, and to forego our traditional round of introductions that we do at our live meetings, I'm going to hand it right off to Supervisor Simidian and to let us know what's been happening at the county. And I can imagine any number of competing urgent and important priorities that have been pulling at your time. Off to you, Joe.
Thanks so much. And am I coming through loud and clear? For those of you I can see on the screen, a simple nodding of the head will be helpful. Thanks so much. Hi to you all. Let me begin by saying thank you to everyone in the community and in the business community in particular who has worked so hard over these last 6 weeks or so to make the shelter in place a successful effort. I think many of you will know, but I just want to underscore the first concern going into this shelter in place was the potential for our health and hospital systems, by which I mean not just the county's health and hospital system, but the health and hospital system that serves our entire county, including private nonprofit hospitals. The concern was that it could be overwhelmed. And I think many of you came to understand that pretty quickly. So there were two goals, and that was to buy some time to flatten the curve, and meaning to push the numbers down, but also to slow the rate of growth. Forgive my virtual PowerPoint here. And the other point was, while we were buying time, to surge our capacity at the health and hospital system so that we could deal with significant numbers of folks presenting themselves in a crisis situation if that were to occur. And I know you've seen the stories from other parts of the country where people couldn't move fast enough either to flatten the curve or to surge their hospital capacity, with tragic consequences. Here in Santa Clara County, and I should mention, look, there's a finite number of hospitals, finite number of beds, finite number of ICU units, finite number of ventilators, a finite number of physicians and nurses. Here in Santa Clara County, we were fortunate, but also I think smart, and the beneficiary of a lot of great compliance, again, from individuals and from businesses, that allowed us to flatten that curve and simultaneously to surge our capacity in the hospital system, so that we didn't have a hospital system that typically counts its ICU, its intensive care unit beds, in the hundreds, suddenly overwhelmed by thousands or tens of thousands of folks in need. We're now at a new point in the process. As I know you all know, the public health officer just announced a new order that'll take effect on Monday. At this point, I should just share with you all something that is not widely understood, and I certainly understand why, but it is that the health officer, the public health officer, Dr. Sarah Cody, who's becoming a household name, has authority to make these decisions unilaterally. And we're fortunate that she's, very collaborative and listening to others. But I've had a few folks say, well, if you disagree with something, why can't we just get the Board of Supervisors to cast a vote to provide direction to do this or that? And as I say, not widely understood, but under state law, the health officer alone has the authority to issue these orders. She cannot be given direction, certainly not by any individual supervisor, but not even by the full board of supervisors, nor can she be overruled by an individual supervisor or the full board of supervisors. As a practical matter, the only person who can overrule her in these circumstances is the state public health officer, should the state public health officer choose to weigh in. So we've been through that first phase. I see this now as a new phase. It is the time when my hope and expectation is that we will chart a path back to normal. I think the public understandably expects us to use this next month for that purpose. My own view is that a key to making that happen is the ability to ramp up our testing capacity for the entire county. And that's an area where I think everyone has been frustrated, in part because it doesn't seem to be anybody's job. Nobody says, oh yes, it's our responsibility to ramp up the testing capacity. I have to tell you, county staff, frankly, has not been very optimistic about the ability of the county to push the numbers up dramatically. My own view, and I think it's a view shared across the county, and we've got a letter from 15 mayors that I think is consistent with this view, is we have to give it a try. Because we don't want to get to the end of May and be told, well, we still don't have the testing capacity we need in order to monitor the virus. And, that would be, I think, a very unsatisfying outcome.
Excuse me, Joe.
Yeah.
Would you rather wait to the end for questions, or as they come in, would you like me to share them?
I'm going to just do two more quick points, Rick, and
Okay.
then I'm going to stop. So I think at that point, we should just go with questions from there. The two actions that I know will be of interest or importance to people who are on the call are our Board of Supervisors did, on my motion, pass a moratorium on evictions for both individuals, but also for small businesses as defined for the months of April and May. May is almost here, obviously, in fact, is here. So we need to figure out, all right, now what do we do? And that'll be coming up at our next board meeting on the 5th or the 12th. But there is that eviction moratorium. To be clear, it is not a waiver of rent. It is an eviction moratorium. The other action that we've taken is to indicate that for those who were late with their property taxes, which were deemed late as of April 10th, that we're going to waive the 10% penalty that would ordinarily apply. Some people thought we should have done more. Some people thought we should have done it earlier. That's a conversation we can have if someone is inclined to have it, and I can explain the thinking. But the short version is April 10th, 10% penalty. It just seemed to me something we did not want to impose at this particular time. Made that motion, carried unanimously, and our tax collector is now in the process of figuring out how to make sure that we can do that across the board rather than require people to make an individual case. I'm going to stop there. There's lots to talk about, but I think we're better off, Rick, if we go to questions. Thank you.
Great. Well, thank you, Supervisor, and thank you too for taking the time out to meet with us. One of the first questions we have is that how is the county set for personal protective equipment? Does the hospital, does the county have sufficient supplies?
I'm gonna say we're doing okay, but we could do better. And forgive me, it's a little vague. Part of the reason for that is that, as some of your listeners will know, PPE is the phrase that now everyone has heard. There's a pretty high burn rate. In other words, those gowns, those masks get tossed. You need new ones. It depends a little bit then on the level of demand. So I think we've done reasonably well. As I said earlier, I think the hospital system benefited tremendously from that 6 weeks to ramp up, to surge their capacity. And while we can always use more, it has not yet reached the crisis point. The place where we clearly are struggling is in terms of the number of tests. And again, I'm not just talking about the 3 hospitals that are now part of the county's health and hospital system. I'm talking about up and down in the South Bay. We've got hospitals who are telling me they literally get to the point where they don't have the testing capacity to test everybody they'd like. to make sure that the environment is as safe and virus-free as they possibly could.
Great. The public health officer, Dr. Cody, I think her department, everyone agrees they've done a remarkable job in an extraordinary situation. I think the next extraordinary situation we're going to be facing is how to get back to normal, a rather poorly defined term at this point. What is the county, how is the county organizing that process? Because more than ever before, I think we are looking to the county as a regional guide in this getting back to our new normal lives.
Yeah, some of you have heard me joke before that the county is the least understood level of government, and that certainly, has been proven yet again, as all of a sudden people have reason to know and care about what's happening at the county level. Here's what I would say, Rick. I think Dr. Cody, it's important to understand, Dr. Cody, as the public health officer, has a tremendous public health knowledge and expertise, but she's not a business person. She's not an economist. She's not an economic development officer. And in fact, we don't have an economic development function really built into our county government. It's not the work that is assigned to the county. So we're at an interesting point in this process, which is, as we talk about the return to normal, whatever that may be, as people imagine it, we can't and shouldn't be relying on Dr. Cody to be making economic judgments. I think we all want to see the recovery as rapidly and robustly as we possibly can, but she's not a person to make economic judgments or business judgments. She's making health judgments. By the same token, as we talk to people who do have expertise in economic recovery, they aren't healthcare professionals. They aren't public health professionals. So the challenge is, how do you get that intersection, again, forgive my virtual PowerPoint, of someone who knows health in a conversation with someone who knows economic recovery, to make sure that the public health decisions going forward are fully informed by the business concerns, and by the same token that business people understand what the health implications are for the public of the decisions they're making at the same time. At the county, to answer your question, we got a couple things we're doing. We're in the process of trying to contract with an outside consultancy, a contractor called IEM. And IEM is already doing work in San Mateo County. And essentially what they do is they provide the bandwidth that we don't have right now while we're managing the public health crisis. They provide the bandwidth and the expertise to go out and talk to stakeholders in the community, including the 15 cities, including the business community, and say, tell us where you are, tell us what you need. They reduce that to writing, they synthesize it, and then come up with what we hope are actionable plans that are not only local, but even hyper-local in some cases. That's a decision that was made at our last board meeting. As I say, we have the benefit of San Mateo County already having engaged them and saying that they think that they're finding that useful. It's a way to make sure that everybody not only gets heard, but that there's some meaningful follow-up. Second thing is, we've just asked that 2 members of our board serve as a sort of an ad hoc task force to work directly with our county executive and our county public health officer. Those 2 board members are Supervisor Cindy Chavez, by virtue of her role as president, and me by virtue of my role as chair of the Health and Hospital Committee. So all 5 members of the board, as you can imagine, are working double, triple duty right now, but the 2 of us are expected to play a somewhat additional role along those issues. But all of that's going to mean that, we're going to hear from Deb in a minute. Deb and her and the chamber in Cupertino are going to have a whole lot better sense of what the economic recovery needs are than anyone at the county. And I don't say that disparagingly. As I say, the public health officer's function is public health. It's not economic development or recovery.
Great, thank you. And a reminder to our attendees, we have 38 people online currently. If you have questions, just go ahead and submit them via chat. And we are, I think this is a good chance if Deb is available. I know we're having some technical difficulties with her video, but you can tell it's her because her name is there.
I'm here.
Great. Well, and so as the supervisor has described, there's the other key player for the arbiter, if you will, of engaging the local economy once again is going to be the city. And so we know, like everyone else, the city of Cupertino is facing some significant challenges. And if you could share your take on the organization and the community, we'd definitely appreciate that.
Yeah, let me try and do that by referring back to the new order that we received from Dr. Cody's office and interpreting, spending most of yesterday making sure that we understood it well. And I'll talk from maybe the city perspective first, and then talk about our business perspective as well. So getting ready for May 4th, we were encouraged by the language in the order that would allow us to bring my public works folks back, for example. So we've had skeleton crews working 1 week off and 2 weeks, 1 week on, 2 weeks off. It's not by accident. The 2 weeks, the 14 days was simply as a safeguard measure to ensure if someone was exposed, that by the time they came back to work on their next shift, we were duly separated by space and time to ensure not more exposure onto the staff. So they'll be back in full force because we have some deferred maintenance that you can probably tell around the city that needs to be addressed before it really starts to become ongoing maintenance issues. So that's good news to me because unfortunately I had to furlough a good 80 people during the second order due to a lack of dollars for Parks and Rec programs. So our summer program is greatly impacted. It will continue to be greatly impacted by the fact that we're not allowed to gather. So unfortunately, we will do our best there. We're taking a look at the potential for summer camps. We're looking at opening our preschool potentially, perhaps for essential workers. But we are definitely going to be opening up like outdoor facilities such as tennis courts. Golf has been allowed as long as there's social distancing and single play, people from the same household who have been presumably sheltering in place. So that's kind of a summary of how this new order affects us. The residential construction that now can resume will then bring back my permit center and site inspection offices and things like that. So I'm encouraged that we can start bringing people back. And we've made, we're putting plexiglass up in all the public counters where we bought thermometers and a checklist to ensure that employees coming into the workplace come in as well as possible. It's a safeguard. It's not a end all be all. So we're making all those preparations now in anticipation of Monday, which we're excited about. I just had a big town hall with our public works department this morning. So with regard to, I'll have to echo Joe's sentiments that we have been running furiously. Cupertino staff has been, despite us not being physically in the office, we have been basically trying to do all of our work that we can virtually. Certainly the department heads and I make up our EOC team. So we have been working full-time plus COVID stuff, and it's probably at least 3/4 time. So it's been extremely busy. And it's hard to kind of do. Things slow us down because, can't just walk down the hall and talk to Joe, for example. So we are working through all of that, and hopefully people have been receiving our daily COVID updates. We've been delivering online recreation and trying to keep our seniors active. So I think city staff has been doing a lot, in addition to our own Angela Sway, who is my main point of contact through business to the businesses. And so what we've done there is we've focused on our small businesses to help them prepare for the mask mandate that I put out last week. We got a very generous donation by a number of donors, but most notably a 20,000 disposable mask donation that the person wanted it to get out to not only community members, but businesses. And so we've given them out to all the businesses in distribution, and given the county order, essential businesses and customers of those businesses. That's what these masks are for, or these face coverings are for. Angela's been doing a great job. We've been trying to keep ahead and in coordination with the chamber to try and communicate, those businesses that remain open. City staff itself, when we do have a need, we try to at least go to our Cupertino businesses first for, whether it's food or other supplies that we possibly can. In addition, you may have seen on Tuesday's council meeting our renters assistance program, and we have now developing a program with a couple of people, most notably Mayor West Credit Union, the Cupertino branch, for low interest loans. So we're doing all of that work. What we are trying to do, what I'm most worried about, is a plan to bring back small businesses in a way such that we can preserve them. And I'm focused there because they just have smaller margins, right, than some of the larger ones. So Angela and I, and we've been in lockstep. She's been a rock star at getting these things distributed and communicating effectively with all the businesses, actually small and large, but focusing on small businesses. And I'm anxious to figure out how we, in coordination with the county, how we reopen to Rick, to your point, kind of to the new normal, so we can get everybody up and running. I have heard that there are other cities who are, for example, you take a restaurant and probably social distancing is going to be required for some time. So how do we open them up? Well, with warmer weather, I wonder if we can't just, block off more of the streets and almost expand their restaurants out into the outside areas so that you can have the same number of tables, but in a larger space. But, thinking about those things, how we help them get their businesses healthy again. I know we've lost some already, but that's kind of where our focus is in this next round. And if there's questions, I'm happy to answer. Like I said, we try to move in lockstep with the county and their orders. And I talk to my county counterpart or my contact there frequently to try and make sure I'm right in line. So.
Great. Well, we do have a couple of questions, and I'm just going to throw them out in no particular order. But to reiterate what you've said, Deb, I think both from the county and from the city, is the amount of information and quality information has been really quite impressive. It's very difficult, and information becomes the fundamental currency that we all need to make good decisions at this time. Now, there's a question about the transparency of communications on the crisis from the county. Joe, I don't know of any particular hiccups. I think the dashboard from the county has been a go-to for every single person I know, resident, business, you name it. Are you aware of any particular issues or druthers that the county is addressing?
Yeah, Rick, I think that the question may be about the specificity of location information. And let me just say first, I do think for those of our listeners who haven't had a chance to check out the county's dashboard at the Santa Clara County Public Health Coronavirus. So that's where you'll find it. I think the dashboards, plural, have done a good job of communicating a lot of complicated and detailed information to the public. And if you were to go back to the beginning of the shelter in place and the crisis, what you would see is that sort of day after day and week after week, those dashboards have gotten better and better. They've gotten more and more comprehensive in terms of the information they provide. And I do want to encourage people, if you think there's information that it would be helpful or important to have, just go ahead and communicate it to my office and we'll pass it along. I can't guarantee that the decision will be made to take that next step, but I can at least help make sure that you get heard or that the request gets heard. The issue though, Rick, finally is, some people are wanting literally location identification information provided. And so, I'm going to make up a number just so everybody knows, 885 Blaney Avenue. And I picked Blaney because I used to live there. So, then all of a sudden you run into some privacy concerns. You've got federal legislation, HIPAA, that is important to abide by with respect to protecting patient confidentiality. And there are also concerns, frankly, about particular segments of the community being targeted for hostilities if we get too precise about where the hotspots are. I understand there's a debate in Cupertino, and that's why I am aware of what I sort of could read between the lines of the question maybe. There's a debate in Cupertino about how much information is the right amount. And that's a tension that's, I think, a legitimate and healthy one that our public health officer is wrestling with even as we speak. But we have been talking about how much information we can provide because we want to provide as much information as we possibly can. On the other hand, we have an obligation, both legally and I would say ethically, to protect the privacy of folks out in the community. And as I say, if you pinpoint it to somebody's particular address, then effectively, you have outed them as someone with the virus. We'll balance all that with the public health needs, of course.
Great, thank you. That makes sense. We all want to be safe, but at the same time, there's different types of threats that we all can face. Deb, the next question is for you. So did you say tennis will be allowed with appropriate social distancing?
Correct. So we have in Cupertino, we have 3 sets of tennis courts that are not at the sports center. So those are the ones I'm talking about right now. The sports center will be slightly delayed because those were more organized and I believe they were by appointment and all that at the sports center there. So we're working on it.
Can I interject here, Deb, for just a second for the interruption?
Sure.
And I only know this obscure tidbit because I got a question about it yesterday. Deb, it's not entirely clear to me that tennis will be permitted under the order between folks who are not household members or residents of the same household.
Correct.
Okay,
I just wanted to
underscore that for Rick and the other listeners. I thought you mentioned that earlier, but it's gonna be a source of frustration. If a husband and wife can play tennis on one court, but on the adjacent court, 2 folks who live across the street from each other can't play tennis. I think understandably people are going to say, what's that all about? I wish you luck. I'll let it go at that.
Yeah, there's gonna, part of this is, excuse me, we're gonna have to put, the reason that we can't do it till Monday even is because number 1, the order's not effective until then, but number 2, it does take us some time to put up the proper precautions, whether it be signage, taping off certain things, making clear that certain parts of the facility are not accessible if inappropriate. So we're also talking about the order states it's no sports with shared equipment. Now, one could argue that tennis has some shared equipment, as in the ball, but everything out is part of the outside facility and each person has their own racket. It doesn't encourage people to gather. And what I'm responding to as well is if we consider it to be somewhat low risk, should everybody follow the rules? And I think they will. I've been in contact with some of our community members who are keenly interested in opening those tennis courts, that they will follow the rules. And actually most of the requests, if not all of them, have been for people who have been either sheltering in place together or family members, or somehow do not have that kind of cross-contamination or exposure issue. And we'll make that very clear on our signage. That is one of the requirements. And thank you for the luck wish, Joe. It's kind of a balance between what, people feeling kind of pent up really, particularly with some of our neighbors who live in very close proximity to our tennis courts, and just a keen interest in helping them kind of get out and stretch their legs the way they want to, but also following county guidance.
Yeah, one of the earliest, just to piggyback on Deb's comments, one of the earliest suggestions I made, which was not original to me, it came sort of secondhand, was that we should not only keep our county parks open, but that we should waive entrance fees so that people had a chance to get out and get some exercise and let off steam. And to Deb's point, the success of the Flatten the Curve effort is a function of the community's willingness to do its part. And I think we have a whole lot to be proud of and a lot of thank yous all around. But that's only going to happen if the public is convinced that what they're hearing is authoritative and sensible. And, it seemed to me we would be setting ourselves up for success if we gave people a release valve by saying, get out on the trails as long as you would observe social distancing. I think that's going to be a struggle going forward, Deb, and I think you're probably seeing that in your attempts to administer some of these programs.
Yeah. It comes down to, you have the few would ruin it for the many, as we saw with some of the Southern California beaches and the governor's new order about those this morning or last night. But, for the most part, if not for be one singular or two people, they've been pretty well behaved on those facilities. We couldn't quite close all the way, like the open space of our parks, right? We had a dogs off leash area in one of our parks, and people have been very well behaved as to not have that, try to redo that right now, because they're not in limits right now to open. So I think it's a very, we'll see how it goes kind of thing. And if people are willing to take the precautions that we are asking them to take, the tennis courts, and the city has a small golf course. We're able to do that for single play. We will open those to the best of our ability and try to resume some sort of normalcy as the months warm up here a little bit. So
great. Thank you all. I think a thread that has run throughout all of these comments is the real profound respect that our different levels of government and ultimately the community have had for data. And maybe that's just part of living in Silicon Valley, but I think it's really a credit to everybody and has underlay the efficacy of the efforts. We do have a question here for Joe about plans for helping homeless people. Are more places becoming available? Or are they being protected from railroad organizations and others who want them removed?
Yeah, this is a bit of a catch-22, as you can imagine, Rick, and thank you to the questioner, because you ask people to shelter in place when you've got 7,000 to 10,000 homeless folks who are out in the county on any given night, and a limited number of shelter spaces. And then if they do take the shelter spaces, how do you effectuate social distancing when people are by definition pulled together in a shelter environment. And the short answer is by sort of running even harder and faster to expand the number of spaces. And we have done that in two of the cities in my district, Palo Alto and Mountain View. We've had efforts underway to expand safe parking programs, which I think some of you will be familiar with, but essentially to create a safe environment for people in cars who are living in their cars or RVs to park overnight and to have a safe and secure environment, trying to expand the shelter capacity that we do have. And then for folks who have actually tested positive for the virus, to get them into hotel rooms so that not only are they okay, but equally, if not more important, that they are not spreading the virus by being in a congregate setting. You know, it's pretty common sense. Anytime you got a lot of folks crammed together in the same place, whether it is a homeless shelter, whether it's our jail, whether it's a skilled nursing facility or an assisted living facility, there's reason for concern. And in terms of folks in the homeless world, we're trying to provide more shelter as fast as we can, including safe parking and including hotel rooms, motel rooms for those who have been identified as being positive with the virus.
Great, thank you. And just to interrupt briefly with an item of business, we've all agreed on the panel that we're going to do our part to help resist the digital undertow that online meetings have now come to manifest. So we're going to try to keep everything to less than an hour for our attendees. And so I just have one more question for Deb. If Deb, you could talk a little bit about the Cupertino Cares program. I know the city's been doing a lot to try to help build social, maintain and build the social fabric during these times.
Yeah, you know, if I'm correct in my recollection, Cupertino Cares, it was kind of interesting. The way it started, if I recall, is we got a couple of questions pretty early on in the first shelter in place for mass donation. And we had heard that, you know, the hospitals in our area were short on some PPE, specifically N95 masks and, you know, hand sanitizers and things like that. So we put out some bins on Civic Center Plaza there by City Hall, 2 of them. And through the generosity of community members, you had so many people donating masks to Kaiser, actually, because I had called a couple of the local hospitals and the other one said they were fine for now. And then I do believe that some of those donations went to Valley Medical Foundation, where I think they continue to need medical grade masks. And just to put a finer point on it, some of the donations we received, we were very mindful that we didn't want the medical grade ones to go anywhere except the hospitals, as long as they needed it. So we were very mindful of that. And so I think it kind of started from that. And then we introduced the initiative sometime in that middle to late part of April. And I'll just read a few things to engage in. What we engaged in were a few community events, social media, and all of that to spread the word on the Cupertino Cares. There were some events already done, like the Home Poetry Slam, to celebrate National Poetry Month. Today actually is the citywide chalk walk. That sounds like a lot of fun. To encourage people to get outside, but socially distant, right? And we're looking for that event that we were going to use, and I think we're still using our block leader program to hand out some of that chalk to get them out to the neighborhoods. On May 8th is something called 1,000 Thank Yous, to say thank you to the frontline workers in our community, which I think is going to be cool. The goal is to send about 1,000 letters or drawings of gratitude to doctors, nurses, sheriffs, firefighters in our community, doing the hard work of all of this. I would tell you that, we're busy, but my heart goes out to the health and medical professionals. So there were just a number of events that came together to support the community and other members doing the work. I wanted to thank whoever asked about it. I had not. I have the privilege of doing a COVID update every council meeting, and this slipped off of my radar. And one of the council people said, "It'd be really great if you talked about that a little bit more." I said, "Forgot. I'm sorry about that." Anyway, so it's mainly to make sure that as a community we continue to stay strong together, because I think that's why we've had such not only low cases in Cupertino, but also just kind of really good cooperation with regards to the orders coming out and the things I had to close. Yeah, there were a few people that were a little angry or startled, but in general, people really understood, oh, this is what's going on. Yeah, I've got it. And I'm particularly proud of the continuation of a lot of our programs for seniors in particular. They are the most vulnerable population to COVID, and they have been sheltering in place. And we've been running our VIA shuttle for those people that can't get around to essential appointments. But at the same time, we are reaching out to them on a periodic basis, to those that want to be reached out to and that have contacted the senior center. So it's all wrapped up into that same philosophy of wanting to just remain a pretty tight community. So that's
Great.
some of the upcoming things, but the attitude is really about we do care about others, and we do care about remaining well.
Great, thank you. Well, I think we came in under a question, but I think there's some thanks coming in for Dr. Cody, and I think for everyone. People are excited to see the construction start again, and I think that's certainly a sign of health for the economic vitality of our community, and that addressing so many of the projects that need to be done, both small and large. But thank you, Deb. Thank you, Joe, for coming in today. Our experience of the Chamber has been that the collaboration is really remarkable. Certainly the needs are even greater, but the level of collaboration with the county, the city, Angela Sway has been an exemplary partner. We've had several online seminars. I know we expect to have more, but for us, the number one group that is our members in the Chamber of Commerce are small businesses. And it just so happens that next week is Small Business Week. I don't know if maybe it's both ironic and appropriate, because Joe, as you said earlier on, the small businesses have the smaller margins, and it's never easy. So to that end, if Angela, you can talk a little bit about what's on your radar regard to our business activities report.
Sure, thank you, Rick. Good afternoon, everyone. I am going to just share my screen here. And so this is the monthly development activity report. You can actually find this online at the city's website under my economic development section. So I'm just going to quickly give some highlights and then discuss some other things that are going on. But what you'll see highlighted in gray is the Westport Cupertino project that the Environmental Review Committee approved that on April 16th. So then that will next go to Planning Commission. That's scheduled for May 12th, and then to go before City Council June 2nd. The next item is the Valco site. So if you haven't driven by lately, that overhead bridge that was over Wolf Road has been demolished and has completely been removed. You'll notice it's actually a lot more sunnier over there than before, but that was all done within like a week time span at the end of March, beginning of April. So that is all done and completed. The next item is the De Anza Hotel. So the development agreement for that project was approved by City Council earlier this month on the 21st. The BMR linkage fee will go to City Council later this month on the 19th. And then the short-term rental ordinance is on hold due to COVID-19. So that's what we have going on. And then just some other things. Oh, Rick, do you have a question?
I was going to say the rental ordinance, could you clarify what it is that's exactly on hold for people who aren't familiar?
Oh, so the city was moving forward with an ordinance on just how to kind of manage the short-term rentals. And I believe right now, the staff work on that has been placed on hold in order for staff to just concentrate on kind of COVID-related matters. So, that ordinance,
like Airbnb, that sort of thing?
correct.
Yeah,
Yeah.
okay.
So Rick, let me weigh in just a little bit here. Also, you know, the staff work on it was complete enough to take to council recently. And because of COVID, we saw that our short-term rentals in the city dropped from about 400 to about 200 in the first week of the shelter-in-place, or of the order. And so there was kind of really nothing to govern or manage. So we decided we'd hold until such time we saw that we really need to bring this forward.
Great, thank you.
Correct. Thank you, Deb. Other things, as a reminder, we have on the city's website just business resources and information in regards to federal, state, regional relief funding programs. So that can be found at cupertino.org/COVID-19 business info. We also are maintaining, in conjunction with the chamber, our open for business webpage. So that's listing all businesses that we know of that are open. So if you take a look at that, and if you know of any other businesses that are not included on that, please send an email to me and we'll get that uploaded. Again, just as Deb had mentioned earlier, we were given that generous donation of disposable face masks. So last week, we began distributing them to open businesses for use by workers and to be given out to customers free of charge. So if you are a Cupertino business and you need masks for your workers and for your customers, please contact me and I'll make sure that you get some of those. Also, just one last thing, just special thanks to the Chamber, our continued partnership in order to support our local businesses. Also, shout out to Kevin McClellan, who wears his SBDC advisor hat. Again, we're all working together to be able to communicate and share whatever information we're getting in regards to funding from the SBA, any regional funding. And also on my site, I've been able to source some private grants that many businesses may be able to apply for. So we're all in this together. Please reach out to me if you have business concerns in regards to moving forward and how we're going to be able to reopen the community successfully and with everyone's understanding on how best to achieve that new normal. Thank you.
Great, thank you. I don't see any questions for Angela. So in the interest of respecting everyone's time, I just want to say thank you again for our speakers, Supervisor Simidian, City Manager Fang. Thank you so much. And thank you for everyone in the community and all of the organizations represented. With the City of Cupertino Senior Center, with the West Valley Community Services, the Cupertino Chamber of Commerce is running a program to provide meals to needy members of our community. So please check Cupertino Together. Those meals go to the Cupertino Senior Center and West Valley Community Services from our local restaurants, keeping everyone busy. and healthy. And so please check that out. And also for next week, it's Small Business Week. We have a webinar, with our Grow with Google program on Wednesday, 9 a.m. Manage your business remotely. That's just about an hour. And then the next day at 3 p.m. we have a virtual social, of course. So we're happy to have everyone. And again, thanks again. Is there anything, Joe and Deb, any closing remarks?
If I could just say thanks again, but also I should have mentioned earlier, Rick, for folks who are still on the line with us, I have been using a telephone town hall format to share information. I've done 2 of them so far. We literally get thousands and thousands of folks listening. We've had Dr. Cody on so she could respond to questions directly from the public, back to the issue of transparency. Also had medical professionals, folks from our county council, our legal office, who could respond to some of these questions. The third telephone town hall is scheduled for May 17th from 11 until 12:30. If folks would like to sign up to make sure they get called at a number that's good for them, they can do so pretty easily at my website for Supervisor Simidian. And the other thing I would say is the last 2 have been archived there. So if people want to listen to the ones we've already had, I'm told they're very good for folding your laundry too. So if you want to fold your laundry and listen to the last couple of telephone town halls, it's right there on the Supervisor Simidian webpage. And looking forward, if you want to sign up for the next one, please do. It's a way to make sure people get their questions answered directly, and the participation so far has been really extraordinary. Thank you all again for what you're doing and for the sacrifices and inconveniences I know everybody on the call is dealing with. Take care.
Great. Thank you.
And
Have
I'd
a
like
great
to
weekend,
thank,
everyone.
I just like
go
to
ahead,
thank,
Deb.
well, I just like to thank Joe and the Chamber for his time. I think Joe is very generous with his time. I should be so generous, but yeah, it takes a lot of time, and thank you everybody for your understanding and encouraging patience with everybody. It's a weird emergency response, right? It's very, I've been through some other emergencies. This is unlike any other. So thank you all for the time. And certainly if there are questions, you know where to find me.
Thank you, Deb.
Thank you, Joe.
Thank you, everyone. Have a great weekend and be
You
safe.
too.